Hi, everyone. It's Dr. Paul Remoliotis, Esoteric Health Unit. Once again, giving you a weekly update on what's going on with COVID. Today, April 6th, 2022. I'm just going to, as usual, share my screen to give you kind of the latest of where we are right now. I can tell you that we are at 7 hospitalizations. Our rates are going up very slightly, like we're seeing in the rest of the province. And in terms of our positivity, we're seeing that that's going up. Last week we were about 10% or so. Right now we're about 13% thereabouts. Again, in the province is about 18%. So it is a slow increase moving week to week. Similarly, we're also seeing higher rates of hospitalization. Right now we're at 7 hospitalized, none in the ICU. And again, you need to compare that with what we had back in January, where we had over 60 cases hospitalized, and at one point we had 12 or 13 in the ICU. And so that's a different, it's different right now, but we are keeping an eye on that. Similarly, what we're seeing is outbreaks in increase as well. We were up, now we're up to 10 outbreaks. A week ago or so we were at 2 or 3. But again, moving back at the peak of the Omicron wave in January, we were at around, I would say, 50 to 60 outbreaks. And so that's what we need to look at. And the other thing that we need to look at with these outbreaks is, like, are people getting sick? How sick are they? And so on. And the good news is that most of these outbreaks come from outside, visitors or staff going in, and some of the residents get infected. But among those residents, out of the 10, none have had to go to the emergency room or the hospital, which is very good. And most of them either have very mild symptoms or no symptoms at all. So again, we have to look at the whole picture as well as the numbers as we move forward. And then if we're looking at our wastewater, that's looking at our own wastewater, right now you can see that we're leveling off. We're pretty low here. I know the Castleman went up and down, but over the last week or so, this is of last week's data, we're sort of stable right there. If you compare with the province, there is a bit of an uptick of cases, upward uptick. And again, these wastewater doesn't tell you severity. It just gives you an indication of how many people have got infected by COVID. And again, one of the things that we're trying to do is we're trying to make sure that that does not result in overwhelming our healthcare system. And that's very important for us. If we're looking at our cases, the way that the cases are, so you could see the black line here is the wave that we had in January. And then you can see we got a slow increase, but certainly not as steep as this was. So we're protecting, and this is the models that I'll show you later, kind of expected that to have a bit of an increase as we go up that scale. And if you look at, it's not surprising that if you look at across the board in terms of our health units across the board, most health units are having increasing, but again, slow increases, but still increases over a 14-day period. Now, if you look at the vaccinations in our area, I'm happy to report that we've finally reached 60% of third dose in our area, which is very good. And it's right now we're about 88% first dose, almost 85% second dose, and now 60% third dose, which is great. And we need to get that number higher, and I will talk about it. But we're still seeing most of the third doses among the elderly, particularly people over 60 years of age. But we still have some work to do in younger people, particularly 12 to 17 as well. And again, we're at the 50% mark, stuck there for the younger children, 5 to 11 years of age. So I want to spend some time on vaccination because, as you know, there was an announcement made today about 4th doses, which I will allude to a bit later. But before I say that, I want those 40% of the population that's listening now in the Eastern Ontario Health Unit area who have not got their third doses. Please go ahead and get your third dose. Clearly, you get much better protection with the third dose as you get versus the second dose, and it lasts. The third dose probably lasts up to 6 months. Anywhere between 3 and 6 months, depending on your age and your situation. So we need to get your third dose on board because, again, the higher optimally protected the community is, the better we'll be able to fend off this next wave, or I call it a mini wave or a ripple that we're actually seeing right now. And again, one of the things that I also want to say is very important, although you see here that this is the cases, there's about 100,000 cases per 100,000. The red are the individuals that are not vaccinated. See sort of a lot of the cases that we're seeing, high rates are more in the younger age group. But the opposite occurs when you're looking at hospitalization. They occur more in the older age group, and particularly among the non-vaccinated or partially vaccinated. And so again, for ICU admissions and deaths, you could see that 60 plus are the more vulnerable. And that's why the announcement that was made earlier this morning, is important in terms of getting that fourth dose. But before I talk about that, what I want to do is I just want to give you a bit of a review. We talked about this last week as well. Again, this is the science table modeling. That's going to change because that was based on modest increase in community contacts, but the contacts have really gone for a lot higher than we expected. But we do expect that there will be a surge. You can see kind of that wave that's sort of a ripple rather than a peak wave as compared to here, both for ICU and for hospitalizations. And so the modeling shows we can have probably, we're maybe estimating 2,000 admissions. Right now, we're about 1,000 admissions in Ontario and about 175 stable, though. The ICU admissions have been stable. The other thing, too, is that death rates have decreased, actually. Out of all the things that we're monitoring, everything has gone up, outbreaks and so on, but the death rate has gone down, which is good news as well. So again, this is what we're trying to do, and what we're trying to do our best right now. Our goal collectively is really to ensure that we flatten the curve as much as possible over the next 4 to 6 weeks. So then, as temperatures get better, people get more vaccinated, the protections are there, that you'll be able to have a much better summer than we've had, much more normal summer, not fully normal, but much more normal summer that we had in previous summers. So finally, I think it's very important. Again, I almost a similar slide that I showed last week, but it's very worthwhile repeating. Please get vaccinated. That 40% that hasn't got their third dose, please go get your third dose. If you haven't got your first or second dose, please do so. I'm very pleased to see that we're still getting people coming in for first and second doses. So please continue doing that, and then get your third dose, and then get your fourth dose if you're eligible. Speaking of that fourth dose, right now, we are basically, as of tomorrow, you can book your fourth dose if you're 60 plus, 60 years of age and older. And that is the recommended interval is 5 months after your third dose, although it could be 3 months or later after your dose. And again, the older you are, probably the earlier you want to make it. But right now the recommendation is 5 months, and the same goes for the fourth dose to 18 plus First Nations as well. Again, just in terms of technicalities, that you can book it online. We will have clinics in our health unit that will be walk-in and others. So stay tuned. We'll be increasing our clinics to accommodate the fourth dose. But don't forget, we also have 40% that need third dose, right? So we will welcome anybody coming in, any age range. And the other thing too is you can book these if you're at 5 months or more post your third dose. You can go online like the usual booking system and book it. If not, you can call the center and get it earlier than the 5 months. So between the 3 months and 5 months after your third dose. So that's very important. But again, bottom line is if you couple that with the immunity that we've had in our a lot of people have been infected. In Ontario, it's millions of people have been infected. So that's the other thing. And the other question that I've got is, I got COVID, and I'm 60 plus. When can I get my third dose? Well, it's 3 months after, but we say about 3 months after your COVID infection, because you will get a couple of months worth of protection, additional protection, like a sort of what I call natural immunity induced by the coronavirus, by the COVID virus, but that only lasts a couple of months. And so that's why you still need it. So there's a preconception that, I got COVID, I don't need a vaccine. No, if you got COVID, you need a vaccine, but 3 months after you got COVID, depending on, if it's your first, second, third, or fourth dose. And that's very important to know. And finally, one of the things that, again, we can do collectively. So if you take all of the people that got infected, if you take people that have had their third and fourth dose, maximized. If you take all that together, we have a high rate of immunity in the community. And then the other thing that's missing for us to be able to successfully, traverse the next month or so of this sort of ripple or wave, lower wave than the previous one, and we want to lower it as much as possible. Really what we need to do is we need to wear our masks. I know the masking mandates have been removed, but masking is a very effective way of protecting everybody. If everybody wears a mask, everybody's protected. If you're wearing a mask, yes, you can, you'll get you'll protect it, not, by getting it, but also importantly, people who have it and don't even know it, it'll be prevent you from spreading it. So the more people that wear a mask, the less the virus will travel, and the safer everybody will be. So I do strongly recommend that you continue wearing your mask in particularly indoor crowded places, or if you're vulnerable yourself, you're uncomfortable yourself, or if you're with vulnerable people around you. So that's very important. I know it's not mandated, but it should be done. And speaking of public health measures, the other thing that we need to do is to ensure that you continue washing your hands, continue doing the disinfection protocols, and making sure that you stay home if you have symptoms. So that's very, very important as we move forward. And so the next couple of weeks will really tell the tale. I do believe that we have all things on our side at our disposal that we can choose to do. Get vaccinated, wear masks. That's very important. And we have the antiviral medications that we can prevent severe disease. So that's where we are this week. And thanks again. I'll talk to you next week.